Hi, my name's Ken Capron. I started a company called MemoryWorks about 2 years ago, and I'm here to start a series called Doogan's Digest to talk to you about things that are of concern to the seniors, and especially seniors and other people with some form of memory impairment called dementia. And there's a lot to cover, and we're going to try to do this a little at a time, bringing in guest speakers. We'll have video at times, and maybe a little entertainment if we can work on that. But there's a lot of things to talk about that people need to know about as they get older. What do you do when you can't drive anymore? What do you do when you can't stand living with your partner? No, what do you do when you need to depend on others or go to an assisted living facility or something like that? We've got a lot of questions and a lot of things to answer. So I'm here to help you to find answers for those questions. And there's a couple of places you can look to supplement what you hear on the show. And I want to make you aware of the things that we're doing to reach you and encourage you folks to come out and take part in the awareness of dementia and all the caregivers that support it. So first of all, we obviously have a website. It's called MemoryWorks.org. That's all one word, MemoryWorks.org. And unfortunately, I'm not able to keep up with that as well as I'd like to, but it serves as a good source for some information and some very basic information. And it also lists our memory cafes, which is our premium offering, which we'll go into in a little bit. I also have just recently started a full-page column in My Generation magazine. My Generation is published in southern Maine by Current Publishing out of Westbrook, and they've been so nice as to give me some space to start talking about seniors and being supportive to the dementia care community here in southern Maine. I've also got a blog on Bangor Daily News website called Journey Through Dementia. And on that blog, you'll find a variety of different types of dementia because there aren't too many places that discuss the 50-plus types of dementia that you can get. But we also include some of the newer programs offered around the country and around the state. For example, one of the foundations has Healthy People, Healthy Places, and it's a well-funded program. If it's not in Maine, we're going to try to bring it to Maine. And also contact information is there. I always try to include a video in those stories, and it's always something that was at least made me feel good or help me deal with or understand an issue. So and then watching this show, we hope to do this show at least 2 issues or 2 episodes a month. Ideally, we'd like to do an hour-long presentation each month or each show. Next month in April, aside from this introduction, we hope to have a presentation from the people at Coastal Rehab so that you'll know what an occupational therapist, OT, does and what a PT does, a physical therapist, a rehab therapist, a speech therapist. That's a company that has done a really good job of building itself here in Maine, despite some competitors who are national who may have better resources. And the owner's name is Natalie Deschanel. She's out in Cape Elizabeth. And we'll also be talking next month with Brett Seekins of Baker Newman and Noyes about a program called PACE, which is truly an intriguing option for those people who are on Medicare, Medicaid, or even private insurance, because it provides a one-stop shop for the patients and their families to get everything done in one place, because transportation is an issue for seniors. So Brett will be here talking about PACE, a program that has 170 centers across the country, 5 in Massachusetts, none in Maine, and there's only 18 states that don't have a PACE, and we're one of those 18. But we're looking to change that. So I wanted to point those things out, and then I also wanted to point out an upcoming event on April 2nd. If you get a chance to see this before then, we have a presentation from a research study, a very leading, cutting-edge research study from California, from UC Irvine. It's called the 90+ study, and it's been an ongoing study for many years, well over a decade, I believe, on people who have made it to age 90 and beyond. And they talk about some of the actual things that they've encountered in their studies that have helped people live longer. It may surprise you that people who exercise too much actually die younger in many cases. People whose blood pressure goes down or stays level may not live as long as people who have a slightly elevated blood pressure. Despite what your doctor said, there's actually some correlation between slightly higher, moderately higher blood pressure and longer life. And certainly gaining weight as you get older is healthier than losing weight and being skinny. So for all you skinny folks out there, it's payback time. So what do we want to talk about this week? I want to introduce you to our memory cafes. Memory cafes, we started, and when I say we, there were a couple of us who started. A friend of mine here in the Biddeford-Saco area, Donna Beveridge, and I started a memory cafe in Biddeford and one in Portland almost 2 years ago. We're just, actually this is probably close to the anniversary of when we started it, because we wanted a place for people who have questions or concerns or have an actual form of dementia or suspect they have a form of dementia or memory loss. A place for them to go where they could sort of socialize, hang out, have a cup of coffee with other folks who have been there, done that, and may have some of their own answers, may have some opinions, but they certainly can share experiences. And we always have some really great discussions. In fact, to do this show, I came from our memory cafe in Yarmouth at Bay Square, and we spent at least the first hour while I was there, we spent talking about some of the reasons why people were at the memory cafe. And in one case, somebody had lost their partner 2 years ago and is interested in finding out whether that's a genetic thing in the family or whether there's reasons to be concerned that they'll get it themselves. There's just too many unanswered questions, and she was looking for a place to get some of those answers, and hopefully we can begin to help address her concerns. We had a very nice lady in Sanford who came to our memory cafe there at Gentiva's office and was very concerned. Her husband had a form of dementia, and they were doing a lot of things, but she felt like she was spinning her wheels, and she thought there must be something she's doing wrong or that she could do better or whatever. But she came, and we spent an hour talking with her about what she was doing, and in every case she was doing all the right things, and she just needed a pat on the back that said, you're doing everything you can, and stick with it, and call us if you need help. And that's sort of the message from Memory Cafes: call us if you need help, because we work in very collaborative environments to make sure that you get some answers to the questions you have. We have one remarkable story which I'll share, although I think it's going to be in the Bangor Daily News upcoming, but we have a gentleman who had remarried his childhood sweetheart. They had been divorced for a while. They happenstance got them back together, and they got married again, and everything was going along nicely until the early 2000s, and suddenly something happened to her. She stopped talking, and she stopped being able to do a lot of the things. She couldn't cook, she couldn't clean, she couldn't communicate in any way, and Pete took her to a doctor to get evaluated, and after a good deal of study, they determined that she had Alzheimer's. And if you haven't heard of Alzheimer's, it's a pretty serious and always terminal dysfunction in the brain that some people believe is caused by growth of plaques and tangles in the brain. But she was diagnosed with that 10 years ago, and she's been checked since and had the diagnosis is stuck and stuff. And when Peter came to the Memory Cafe, we started to get familiar with what his concerns were and what his wife was like. And some of the things he was describing just didn't seem to fit the Alzheimer's diagnosis. And keep in mind, there's 49 other diagnoses that make up the dementia spectrum. So I took it upon myself to go visit Peter and his wife, and got a chance to see where they live and got a chance to meet his wife. And in introducing myself to her, her eyes just focused 100% on me. It was just like a dog waiting for food, and that stare that you get. I'm trying to tell you something, owner, and I want you to feed me or whatever. But she was very intent on trying to communicate with her eyes, what she couldn't communicate with her vocal cords. And I looked at Peter and I looked at his wife and I said, you may want to seriously consider a second opinion or a third opinion or whatever opinion it is, but you may want to consider having Peggy looked at again. And he did that three or four weeks ago. And after living with her for 10 years without her being able to speak, that's called aphasia, it was found out that she actually had an MI, a clot in her brain that years ago took her ability to speak away. Now she's on a different regimen. She's being treated for stroke, and with stroke medication and stroke therapy, which involves speech therapy, occupational therapy, physical therapy. And there's actually a good prognosis that she will gain back a good portion of her abilities now that she's being treated for the right thing. So that's one of the things. That's a more heartbreaking story that we can relay, because there are a lot of stories that come out of the memory cafes about the trials and tribulations that people have been through, and the frustration and the embarrassment. I've had people who have come to me and said, I'd be too embarrassed to go to a memory cafe because I don't want other people to know that I'm struggling with memory. Well, I'll be out front with you. I've been struggling with memory for over 10 years, and I had to get over that embarrassment, because I would forget people's names like they were going out of style. And people would look at me like, so I don't matter to you enough for you to remember my name? But that wasn't the case at all. It wasn't something that I intentionally decided I liked somebody or not. It was just, it wasn't there when I went to call it up in my memory. It just wasn't there. And so it was embarrassing, until I got to the point where I realized that other people were doing this, that it was part of the symptoms of dementia, and to get over it, frankly, to get over it. So if you're running into a senior who's not remembering your name, don't take it personally. It's not a personal thing. It's one of the many symptoms of memory loss and dementia and what have you. Now, like I said, there's over 50 different causes for dementia. We often hear the word Alzheimer's being used because that's one of the more prevalent forms of dementia. I think there'd be I certainly would debate with some people whether it was as much a percentage of the overall picture as some people want it to be. I actually think that there are other forms, particularly vascular dementia, which has to do with the blood flow through the brain and lack of blood flow to certain areas of the brain. And I say that because with vascular dementia, I know some people who have it, who have been diagnosed with it, but in the 90-plus study, which is coming up on April 2nd, they actually found a very strong correlation between memory impairment and what would have been diagnosed as Alzheimer's and what is called microinfarcts, small blood vessels bursting in the brain. And if you want to know what I'm talking about, if you've ever seen anybody with a blood vessel burst in their eye, that's essentially an infarct. But when it happens in the brain, it kills brain cells which don't regenerate, whereas in your eye, your blood cells, your blood vessels in your eye do heal and regenerate. So that means a lot more when it's happening inside your head than when it's not, when it's on the outside. So just briefly, just to go back to this, my generation has made a commitment to me and to MemoryWorks to help us get the word out about dementia and let you folks know it's safe to come and talk about at the memory cafes about any concerns about memory or about aging. Anything we do to help people with dementia also helps people with their aging process, because we face similar issues, whether it's balance issues or being able to manage checking accounts issues or whatever it is. It's very closely related in symptomology to aging. But in fact, if you look at what Johns Hopkins and the Mayo Clinic and others say, memory loss is not a natural consequence of aging. That's a direct quote. Memory loss is not a natural consequence of aging. So just because you're getting old doesn't mean you have to be forgetful. And I like to point to Betty White, who's probably one of the best examples of an elderly person who's still living a very smart, humorous, comical, active lifestyle, even at her advanced age. So age is not really the factor that affects memory the most. It's usually some other treatable or manageable form of dementia. So what are those other forms of dementia? Well, there's some that you can treat. For example, a B12 deficiency. A B12 deficiency can lead to various forms of problems in the brain, because the brain relies on B12 to function appropriately. Just like a car needs gasoline, the brain needs B12. And it can show up as just confusion, or it can show up as delirium. Another form that you're probably familiar with, Michael J. Fox, he has Parkinson's disease. There's a level of dementia with Parkinson's disease, which really is hard to pinpoint because it's different in every person, essentially. But maybe next week, Coastal Rehab can talk a little bit about their Parkinson's effort, because they have some physical therapy activities now which really help strengthen Parkinson's patients and restore some abilities. There is a frontal temporal dementia, and what that means is the frontal lobe and the temporal lobes are deteriorating and often shrinking. But then there's just plain diet can cause it. That's certainly treatable and curable. Sometimes an infection in your body can display itself as a memory impairment, which is a sure sign that doctors look at to check if you have an infection like a UTI. One of the first things that they'll see is that there's some sort of confusion in the brain's thinking and activities. One of the other things that we can talk about, I'd like to bring in an expert for you who talks about when is the right time to give up driving. Because one of the most important issues that we've found for seniors in general, but certainly for people with dementia, is the loss of transportation. And we here in Maine no matter where in Maine you are, don't have a really good transportation system, especially for seniors. And to get a sense for how that feels, I want you to put yourself in the place of, well, even right where you are now, if you suddenly could no longer drive to the store to buy milk when you run out of the refrigerator, and you have to either pay for a cab, wait for a transportation company, or maybe even take a bus. If you're in the Biddeford or Portland area, Biddeford, Saco, Portland, and around, you've got a bus you can take, but imagine standing on a snowy, cold day waiting for a bus to come along that's running 5 or 10 minutes late, and getting on the bus, maybe having to switch buses to another bus just to get to the grocery store. You get your groceries, you can't carry as much as you used to if you had your own car, and so you end up making more trips to the grocery store, and then you get home, get on the bus again, get back home, and you have to lug your groceries in from the bus stop. And if you're like me, and I tend to bring home 3 or 4 bags every time I go, that's going to be more of a challenge as you get older, as our strength declines. So transportation is an issue we're looking at. I don't know that anyone's got a really good solution for that. Most seniors rely on family or friends or neighbors, or people they meet through groups or churches or what have you. I remember years ago that the local church often helped people find rides and stuff. But just imagine yourself being put in that position like a senior is, of having to find an alternative form of doing for yourself. It's about losing freedoms. Every day, when you're a senior, or especially when you have dementia, every day you lose a piece of the puzzle. And as much as you'd like to pull that puzzle back together, it's just not there for you. You can't figure out ways around certain things. So getting back to Alzheimer's, it may be, I'm going to say 20 to 40%. Some people would say 40 to 60% of all dementias. But on the other hand, 20% of all dementias are estimated to be reversible, or at least not get any worse. And what I will say is that in Maine, it's difficult to get a really good diagnosis the first time around. I strongly encourage people to get a second opinion, even if it's been many years, because I know of, in the short time I've been at this, I know of at least 6 cases where there were erroneous diagnoses offered, people put on the wrong medications, and so forth. So we got to get good information to make good decisions and get proper treatment. So let me just kind of summarize what I've been talking about. Our goal is to raise awareness and to counter the stigma of dementia. I think we're trying to do that through, as I mentioned, the publications, through a blog, through TV, through any publicity we can, by having events and outreach. We want to raise awareness. We also want to try to bring together collaboration amongst the many providers in this industry, because it does no good for you as a patient or you with a memory impairment if people are competing for your I hate to say this, but for your dollars. It would be much better if people were competing from a compassionate level about making sure that you are getting exactly what you need, not what they not what they determine is affordable under some insurance program. But so that's part of where we're headed, is identifying people, making people aware of it. If we can get more people to come forward with their dementia, we can start to actually change the whole paradigm and find better ways to treat more economically, more effectively. And we're looking at programs to do that. But the place to start, this is self-promotion all the way, is with our memory cafes, which are listed, all 17 memory cafes, we've got 17 statewide now, are listed on our blog site on Bangor Daily News, which is called Journey Through Dementia. You just Google BDN blogs, Journey Through Dementia, and you'll get there, and you'll see all 17 memory cafes are listed there on the right-hand side. We also, in this past month issue of My Generation, published all of the memory cafes except for 2. And those 2 just hadn't been set up yet. So that's another source where you can find all the cafes, and then the website, obviously, the MemoryWorks.org. I try to keep that up as best I can, but I feel like a one-armed paper hanger who's got too many jobs to do. We just do the best we can with what we have. We would love to have volunteers, whether it's to help facilitate memory cafes or to help us write. If you like to write, we've got lots of opportunities. There's a lot of really great stories that are coming out of the memory cafes and need to be told, and people need to hear what other seniors are going through. You know, not all of us can jet off to Florida and buy a condo down there and live happily ever, tax-free ever. Tax-free after. And so come out to the memory cafes. There's one here in Biddeford. We do at Elements. We do one at the Monarch Center in Saco. We do one at the Paul Hazelton House behind Rite Aid here in the Saco Biddeford area. We do one at Home Health Visiting Nurses out on Industrial Way. And that's just in this area. Like I said, there's 17 statewide. We've got Yarmouth, Cumberland, Falmouth, Portland, Kennebunk, West Kennebunk, Sanford, Springvale. And like I said, we're going to go to 25 this year as a minimum. So we've got a lot of growing to do, but a lot of interest in helping people with this. So let me kind of leave you with some thoughts. Just keep in mind that if somebody is getting old, that doesn't mean their memory has to go. If you're having memory problems, come see somebody, whether it's us through a memory cafe or you can call me directly at any time. I think my number is going to be on the screen. If not, the station here has it. The cafes, we're trying to get out to places where you can come. But if you can't make it to a cafe, call any provider, and ask them, what can I do? I'm concerned that I have dementia or memory problems, or my uncle or my aunt or my grandfather or my mother or whoever it is has memory problems. And get them out to see somebody. Get them evaluated, because sometimes 20% of the time it can be reversed or stopped. So let me sign off for today and invite you to join us at the Memory Cafe. Have a cup of coffee with some other people in the same boat, whether it's the Titanic or the Constitution. Whatever the boat is, we're going to make it float, and we have a lot of time, a lot of fun, a lot of good times, a lot of laughs at the Memory Cafes. I'm Ken Capron. This is Doogan's Digest. We'll see you in the next episode. Hopefully we'll have Natalie Deschanel and follow that episode with Brett Seekins talking about PACE. Thank you.